thank you for introducing us. Thank you for having us, too. We're super honored to get out here and get to speak to you guys about what we do. As he said, my name is Chris Coplen. I'm the Community Services Coordinator. This is Caleb Knowlton. He's our Special Projects Coordinator. And we work at the Stigler Health and Wellness Center. Do you have the clicker? Sorry. Oh. All right, so we are currently Oklahoma's largest rural community health center. We are an FQHC. We serve East Central Oklahoma. It's 7 counties in Oklahoma. We began seeing patients in about 2005. That first day we had 8 patients. We also had 8 employees, so that we have grown quite tremendously. In 2018, fast forward just a little bit, we started seeing 26,811 patients, and we had 107,511 encounters that year. Fast forward a little bit more to October 2019, and yesterday we actually had 700 scheduled appointments on our schedule. So the little circle there is our service area in Oklahoma. The yellow or gold stars are the bigger cities closest to us. We kind of giggled yesterday about a speaker because she said, you know, it's bizarre that you have to travel 40 miles to see a specialist, and we don't disagree. That is crazy to think about. It's absolutely insane. But for us, where we're from, we have our patients driving 40 miles just to see their PCP. So it's not out of the ordinary for us to see that. Just for a little, I guess, time frame, we are actually located right directly in the middle of that circle, and to Fort Smith, which is our closest start, it's about a 45-minute drive. So that kind of gives a little bit of an outlook on where we're at currently. So moving on a little bit more. We have 7 clinics in the surrounding areas. We do have a rehab facility in Pittsburgh County, so that's the orange star, and our actual clinics are the yellow. We do have a mobile dental unit as well, and that kind of services the places that we don't have dentistry in, and our only location for dentists is in our Stigler location, so that's the Haskell County, right in the middle. So our mobile dental unit goes to the surrounding communities, and we typically have a dentist, a hygienist, and an assistant on board that to service those areas. In our clinics, we have medical and behavioral health in all of our clinics. Only a select few have the other services just because we're kind of varied on where we are in our locations and our buildings. So it kind of changes some things. We do have an in-house pharmacy in Stigler, so that's been fairly nice for our patients. All right, so for our actual telehealth goals, here pretty quick, I would say in the next few years, we would really like to optimize our community partnerships. So in rural Oklahoma, there is hardly any other way to get out what you do and what you are, and that we actually have telehealth besides word of mouth. So to get out in the community and see those patients and actually talk to them face to face, or just people on the street, it's very important to have that conversation with them in person and not necessarily through a text message or a phone call. And so with our schools, we are in a few schools. We want to reduce our absenteeism in those schools. You know, if students aren't in class, they're missing a lot of information. Our teachers, they're missing a lot of information. Caleb was a teacher for a really long time, and he always says, you know, it was easier just to go to work sick because it was too much of a hassle to get together all kinds of information for those students and your substitute. So to have a way for them to be seen by a doctor was very important in our communities. And then for our jails, we are in 3 county jails as well, and that is to help them with their costs. It is very costly to get an inmate from the jail to our clinic. In our clinic, it makes other people a little cautious and nervous, and so that doesn't really jive well for others. So it's really helped them in a way of they don't have to pay everybody. They have to have guards. They have to have somebody drive them. They have to have a crazy amount of people go with them. And it's actually reduced the amount of sick inmates because they don't get to leave their cell anymore. They actually just stay there. So for the next bullet, we want to reduce barriers to care that exist in our patients' community. So we want to get to them and not create something worse for them. Like I said, they're driving 40 miles out of their way sometimes to get to us, and we want to reduce that as much as we can. So to improve our access to care, we want it to be both affordable and convenient. And so with that, I'm going to kind of let Caleb take over, and we'll just go to our next slide.
So we got into the telehealth world a few years ago and actually started with VSee. So VSee's been with us from the beginning as far as our telehealth experience. And what we started with actually was a psych provider. So we were having a hard time finding psych providers, and so this kind of opened up that door to someone that didn't live close by, and then we were able to do that. We actually have 4 full-time psychiatrists that work for us now, but as Chris mentioned earlier, it's really hard to make sure that all 7 clinics are staffed appropriately, so this telehealth model kind of opened up that door for us. So we may not have a psych provider at every single clinic location, but we may be able to offer this service on certain days that they can connect with those patients via telehealth. So we started with site to site and added peripheral equipment this year because, again, we had only done the psych model, and we actually had a nurse that was on site with the patient to handle everything. So this year we've kind of got our feet wet with what happens if there's not a nurse with that patient. We actually got a grant that was for mental health expansion. When we were all sitting around the table trying to decide what to do with that, that's where that high school education background came in for me. As Chris mentioned, students missing class, teachers missing, those mental health services that I could think of students immediately that sat in my class all day long, that I was trying to teach math, I was trying to teach speech, but there was a lot more going on at home for them, or there was a lot more going on outside of my classroom. And those students are who I thought of that really could benefit from these services. So we went with this rollout with a remote site set up in our schools and community colleges, specifically focused on mental health expansion. But this year we've also kind of ventured out into the medical realm. So adding that equipment, it occurs within a private area within the facility. The team consists of one of our providers, trained staff at the remote site. So it's not like we're putting a 5-year-old in a room with this equipment saying, hey, best of luck to you, but someone's trained at their side, whether it's a school nurse, office staff, someone that can kind of help run that side. And then we use Freesia for an online check-in. So as far as parents being able to sign consent forms, that can all be done electronically. So it still saves them from having to go to the school. And then one of the things that we've loved about VSee is being able to add that parent into that conversation. So that was probably the scariest thing when we rolled this out, is parents were a little nervous about putting their child in a room with a provider and them not being there. But with VSee, they're able to jump on that call also. So that's been a great advantage. So each site was provided with either a 70-inch touchscreen monitor and we have a lot of people that help us, and I was going to ask this question. It's a 14-inch, but I forgot to update the slide. But a 14-inch laptop computer, and then a series of extra devices that go with that. So as you can see, most of the schools or the jails, Chris brought up the the county detention centers, kind of the same concept. So it kept them from having to transport. It saved them a lot of money there. And our jails have probably used it even more than our schools have. The jails has become a daily kind of thing for them to see an inmate. One of the places we were working with had hired a physician that came on for 1 hour, 1 day a week, and they just tried to see as many inmates as they could. And so there were a lot of times they would go without care for the rest of the week. And so now they actually have access to us throughout. So we have the 7 clinic for site to site. Our residential treatment facility for substance abuse, they're also involved. 13 public schools. Some of those schools are multi-site, so there's multiple setups at each location. And 3 community colleges, 3 county detention centers. And the one that we're kind of piloting right now that we're kind of seeing what all we can do is with a home health agency. So we sat in a room with a bunch of home health agencies and said, what would work for you? Because we're trying to reduce hospital admissions. We're trying to reduce ER visits. And that was one of the things they said, is they just don't have time to sit and wait on trying to get a hold of a provider, or it's just a lot easier to send the home health patient to an ER. And we're like, that's actually what we're trying to stop. So trying to figure out a way to work with them so that they could turn around and do a virtual visit with that patient while they're sitting there in the home, and maybe stop that ER visit or get that patient what they need all right there. So several of the benefits with the telehealth, these patients actually have access to our sliding fee discount, our 340 Basics program. We have a diabetic lifestyles coach that's starting to meet with patients like this, because again, wanting them to come in for education is really hard to do, but if you say, hey, can you call me for 10 minutes, they're a lot more likely to jump on. Health education programs, kind of the same thing, and that's where we've brought Chris on board, is to run some of those education programs within the schools. So we did over 2,000 telehealth visits this year. So for a small community, we were really excited about that progress, to see 2,000 of our patients via telehealth, and hopefully plans to really grow this in the next few months. So we're getting the stop sign, so we will we'll take questions. I put mine and Chris's information up there, which you guys also have on the app. But then we have a very strong management team. We're the groundwork people, so there may be some questions that you have that I may tell you, hey, write down their information. So, any questions?
Thanks. I was just curious about some of the works in jails. Do you do any works on jail transition after people are sort of released back into the community, in terms of they've had access to this virtual service and then are out and about now?
Yeah, that was one of the things that was really a goal with the jail sides. I've heard mentioned several times this week about that personal connection with the provider, because we have opportunities to do telehealth with other providers or other platforms or whatever, but with VSee, they're able to connect with our provider. So when they get out, our whole goal has been, are they establishing care with someone within our clinic? Are they seeing a counselor? And that was something that was really big with the jails, is can we get them in for some behavioral health counseling? And when they leave, that counselor that they've been talking to while they were in jail is the same counselor they can drive down the road to and schedule an appointment with. So it's all hometown, it's all local, and we do have behavioral health counselors in every site. So that's been a really cool thing, is to get that established.
One last question. How you handle the connectivity issue and the internet problems in those remote communities?
That's a huge issue. That's probably been one of our biggest roadblocks, is that we do have people, once you get out into those further rural communities, is not having that connection with a home situation. In that case, it may be that they're still able to come to their closest clinic. So maybe they're, like with psychiatry, there's not a psych provider there at that clinic, but we can get them to one that's 30 miles away at a different clinic. So there are homes that do not have that internet access, so that opportunity isn't there. So still trying to help them out a little bit, if we can do the site to site with them.
I'm going to add just a little to that too. So we, even with like the people who maybe do have the access to it, we still kind of preface this as it's trial and error. We're still trying to figure it out ourselves. So it's more of help us help you, and we'll try to both get there at the same time. So we're still really, really working on it, and that's still something that we're hugely working on and trying to figure out, but we make sure that our patients know that it is still an issue and we're trying to work on it too. So that's kind of what I wanted to add.
Thank you so much for the amazing